Our government is announcing new measures to support seniors during this pandemic. We need to be there for those who have built this country for the rest of us, and that's what Canadians will continue to do. But there's a lot more work to be done, not only to find short-term fixes, but long-term solutions. COVID-19 has exposed some uncomfortable truths about our society, including how we care for seniors in Canada.
Hi, and welcome to Power and Politics. I'm Vashi Capello. Additional financial support announced today for those most vulnerable in this COVID-19 pandemic. Here's what you need to know. The federal government is rolling out a one-time payment for 6.7 million of Canada's seniors, an extra $300 if you're eligible for the old age security pension available to those 65 and older. That goes up to $500 if you're also getting the guaranteed income supplement, a benefit for lower income seniors. And no need to apply for these funds. They're going to be transferred automatically. Overall, this will cost the government $2.5 billion, but broken down, that means about an extra cushion of $5 to $10 per week for Canada's seniors over the next year. So why not more? Or why not raise the OAS permanently, as the Liberals promised during the election campaign? Deb Schulte is the Minister of Seniors. She joins us from Ottawa. Hi, Minister Schulte. Good to see you again. Thanks for being with us.
Nice to see you too. Thank you.
Minister, your election promise was to give a 10% boost to OAS for people over the age of 75 and to give a 25% increase to their survivors' benefit through the CPP. Why not just do that instead of what you announced today?
Well, actually, what we've done today is actually done more than what we had in our campaign promise, our platform promise. We've supported not just those 75 and older. We've supported all of those seniors across Canada. There is a total of 6.7 million seniors that receive OAS, and they'll be getting $300 tax-free in their accounts to help them through the COVID pandemic, impacts and the extra costs that they have. We've got an additional 2.2 million seniors that get the guaranteed income supplement. They'll be getting an additional $200 tax-free. So in total, they'll get about $500. They'll get $500, and if they're a couple, they'll get $1,000. So if you add that to the GST top-up that they got in April for the low and modest income seniors, they've actually gotten for those on GIS about twice as much as they would have gotten through our campaign promise. And we've obviously helped more seniors than we would have just limiting it to those 75 and above.
It is just a one-time payment, though, which is something that's been, made explicit to me through various seniors organizations. I take the points that you've just made, but they are emphasizing that it's just a one-time payment. The promise that you made in the campaign would have amounted to about just over $700 a year extra for those on OAS above or over the age of 75. The promise was to bring it into effect this July. What happens to that promise now?
So obviously the government is focused on dealing with the pandemic, and the campaign promises that we've made. We'll be working to implement those after we get through this very serious impact, health impact, and the pandemic. So the focus is really on today and now. How do we help people get through with the additional costs that they're facing? And this is what we've heard from seniors across the country, that despite the fact that they're still getting their pension, they're still getting their old age security and their guaranteed income supplement, unlike many other Canadians that have lost their jobs and losing their businesses and have needed supports to get through, seniors needed some help with the extra costs. They had dispensing fees were increasing because they couldn't get their 3-month supply. They would, only be allowed to get medication 1 month at a time. They had transportation cost issues, more costs on groceries and their services that they were trying to get. So we were hearing this across the country from seniors and from stakeholders. And so this is a way that we've addressed those additional costs. And it's a significant amount of money. It's $2.5 billion that we have provided in this measure today.
It is significant, but it also, I mean, you've got $9 billion, for example, for students, not to take away from the need for students, but that is something that seniors have pointed out to me as well. And again, respectfully, I understand your point about the costs that they've incurred at this one point and that they have increased costs now. What I keep hearing from seniors is that those, that they have a lot of costs over time and that they were certainly looking for something, I guess, more permanent. And my question to you on timing, I take the point that we're in the middle of a pandemic, but does your government still plan on fulfilling the promise that you made in the election to boost OAS for those over 75?
Our government is committed to coming through on their promises, their election platform promises. It's just right now we're focusing on the immediate needs of Canadians during this pandemic.
And my understanding is as well that the $300 and $200 is automatically delivered to those who are already on OAS and GIS. Do you have a timeline for when people watching right now can expect to see that money?
Correct. They will be, they don't have to apply for it. It's going to be automatically dispersed and deposited in their accounts. And obviously we are working as fast as possible to deliver on this particular commitment. And so it'll be in the coming weeks. Thank you.
So that's the most specific timeline you can give us right now, just in the coming weeks?
At this point, we're working on the details, and this is something we want to get out very quickly. This is why we're doing it this way. It's to get it as fast as we can into the accounts of seniors that are facing these additional costs. And so it will be in the coming weeks. We'll have more to say as we get the details resolved.
I do want to ask you about one other thing while I have you here, because this is sort of part and parcel to the discussion around seniors in this country right now, and that is the sort of horrifying situation unfolding in long-term care homes right across the country. We know, for example, from public health officials that more than, or I think just about 80% of all the deaths that have taken place because of COVID-19 in Canada have occurred in long-term or due to cases in long-term care facilities. Will your government, at the conclusion of this, not now, but at the conclusion of it, launch a formal inquiry into what happened?
So you heard the Prime Minister today talk about this issue and the tragedy that has manifested itself in Canada. Obviously, as you've said, we're quite focused on helping the provinces and territories today keep people safe and deal with those issues that are arising. However, the Prime Minister said today that the federal government will be there to help the provinces and territories to find lasting solutions for this crisis.
What exactly does that mean, respectfully? Because what I heard from the Prime Minister was a lot of deference to provincial jurisdiction. And I know that there is provincial jurisdiction over the operation and the standards of these long-term care homes. But I also know that, and I'm sure you're hearing from them too, people are horrified at what has happened inside them. And they're not too worried about jurisdiction. They just want some government to be accountable for it. Ultimately, will that be your government, and will you launch an inquiry?
So there is no doubt that it is horrifying, the stories that we've heard. I just want to make sure for the viewers, I have my mother-in-law in a long-term care facility in London and my father-in-law in a seniors residence, and I have to do a shout out for those frontline workers that are keeping our seniors safe. And there are many excellently run long-term care facilities and seniors facilities that are doing an excellent job. So I just want to do a shout out to the heroes on the front line. But there is serious faults and issues that have been revealed through this crisis and this pandemic. So we are going to be working with the provinces and territories. As you've mentioned, it is their jurisdiction. However, we will be working closely with them as we work through the challenges that have been made very obvious.
With respect, Minister, and I concur when it comes to the staff and those on the front lines, and we are all very grateful for the work that they're doing. But my question is more around the system. And when you say, and the Prime Minister says you're working with the provinces, I don't really understand what that means.
Well, the provinces are responsible for the health care, the delivering of health services to citizens within their provinces and territories. So, this is why it is important that we work with them. I mean, we do health transfers, but they're responsible for the delivery of services on the ground. So there is.
To be fair, though, Minister, with respect, during the last campaign, the Liberals were promising a specific envelope of money for long-term care. It's not completely out of. I understand that health care is provincial jurisdiction, but it's not completely out of the realm of possibilities that the federal government could set up a commission. If you're willing to fund that care directly at some point during an election campaign, surely you might want to look into the delivery of that care.
So there's no question we'll be working with the provinces and territories to work on what solutions are appropriate for the future. But right now, it's most important that we take the Team Canada approach. We are working with them very closely. As you see through staffing, we've got the military involved, we've got protective equipment, we've got money on the table, significant amounts of money on the table that are helping the provinces and territories deal with this pandemic, and specifically dealing with the issues in the long-term care and essential workers across all of the provinces in our economy. Our essential workers are on the front lines, putting themselves at risk and need to be paid appropriately. So we have put money on for a wage subsidy that has been worked out with the provinces and territories so that we can make sure that those that are out there working to keep us all safe are recognized for their contributions and appropriately recognized. So you can see there's lots of work to do in terms of staffing, in terms of facilities, in terms of protective equipment, and we also got involved in laying out guidelines and standards to try and bring some consistency across the country and some advice for those facilities that wanted to know what's the best way to keep their residents safe. And we did that in conjunction with the public health agencies across the country.
I would only point out that those are voluntary guidelines, but I do take your point. Thank you for your time, Minister. Appreciate it very much.
Thank you very much, Bessie.
That is Federal Seniors Minister Deb Schulte. We want now to get some perspective from someone who is affected by the announcement today. We're joined by 81-year-old Malone Sinclaire, who lives in Vancouver's West End at the Haro Park Centre Care Home. She joins us from Richmond, BC. Hi there, Malone. Great to see you. Thanks for being with us.
Thank you.
So I want to start off, before I get your reaction to what the government announced today, if you could just outline for myself and for our viewers how the pandemic has affected your life so far.
Well, on the financial level, I've just been listening to what you were saying with her about the finances. This one-time payment will help with the higher cost of living that's occurred because of the pandemic. The groceries prices have gone sky high, it seems, overnight. And rising because there are shortages and people are hoarding. That's part of it. So financially, it has been a strain. And emotionally, it's a bit of a hardship for a lot of my neighbors in the building who have to go out and shop for their own groceries. Like in my care facility, we have full nursing care. We also have independent living people who are still healthy but aged, so like me. So standing in line for long periods of time to get into a grocery store is physically hard as well.
Do you go to get your own groceries, or does someone help you with that?
I have some help where there are things that I can't get in the neighborhood. For instance, the other day I was trying to get some hydrogen peroxide and rubbing alcohol. Nowhere in several stores in my neighborhood did they have any. It was all sold out. So I was talking to a friend and he said, well, I'll check here in my neighborhood, which is Richmond, south of Vancouver proper. And he was able to get it for me. So yes, that's a case. And in terms of the financial problem, to some extent, yes, I had space on my credit card, so I've used my credit card for some groceries. But I also have a son who is a help. So many of us have family and friends who can help. But I realize that I have neighbors who have no one else.
Let me circle back to what the government announced today. And when you say that, your costs have gone up, the amount they announced, and I'm not sure which applies to you, if it's the $300 or the $500, but it's a one-time payment. And a number of organizations that represent seniors have told us they're looking for something a bit more permanent, especially if these conditions last, 6 months, a year, that kind of thing. How do you feel about that?
Well, I've been thinking about that myself. It's been a great help. I got $381 from the provincial government recently, and that certainly helped, but that lasts a short period of time, of course. And I'm sure that the cost of living is not going to suddenly drop when the COVID is over. A lot of businesses have had financial difficulties. It's not just going to go back to the way it was 4 months ago. So it seems to me that the cost of living is going to stay high for a while. We need more ongoing assistance.
What is your feeling? I mean, so often we hear politicians talk about how, seniors are the people who sacrificed everything so that we can have the life that we have. And certainly it's not just politicians saying that, it's all of us. But there are so many questions right now about, for example, long-term care homes and the situation that we see evolve in them. And I'm wondering how you feel as a senior in Canada. Do you feel like Canadians are looking out for you? Do you feel like the government is looking out for you? How do you feel?
Well, probably because I also watch CNN news and keep track of what's going on in the United States, partly because my son and my granddaughters and my daughter-in-law live there. And but when I compare their health situation to ours, I'm much appreciative that I'm born and living in Canada. On the other hand, this is probably the first time in history that we've had so many seniors at one time. So I recognize that with the baby boomers and so on. So I'm grateful to be here, and I'm grateful for what has been done so far, and really wonderful that we haven't had to go online and apply for it, because many of us seniors are not as technically adept as our younger family and so on. So not everybody could do that. I, for one, am going to have some problem sending in my income tax this year. I won't be able to do it myself online. Someone else is going to have to do it for me. So there is a need to consider that many of us, here I am at 81, and somebody's told me I might live to 100. Well, it would be nice to know in Canada that I'm not going to be stressed financially until my life is over.
And what about the piece on, or the issue surrounding care homes? You're in a home that's not necessarily like it's for independent living as well, which, as you described, you do. But do you have any worries based on what you've seen unfold under this pandemic about your care in the future?
Oh, yes, absolutely. Because Haro Park Center in the Vancouver health area has had the most deaths of any of the other care homes in this region. And one of the things I am aware of is that the care aides and some of the care staff are only hired part-time, and this is throughout the system in the province. So for many of them, they can only get part-time jobs. They have to work at more than one facility in order to have a living. Now, that's one of the reasons I think why the COVID spread so quickly in the care homes. And if that situation doesn't change, that means a whole change in the care system where everybody who works in it can get a decent living working at one facility. So that's a concern. Now, I have listened to Dr. Bonnie Henry here quite a bit in our province, and she did mention, in fact, that something like that has got to change in the care homes for seniors.
Yes, we've been listening to Dr. Henry a lot too. She's coming up a little bit later on the show with her update. We'll bring that to our viewers live. I really want to thank you, Malone, so much for sharing your perspective with us tonight. I appreciate it, and I wish you the best health, the continued health throughout all of this.
Thank you. I appreciate the opportunity.
That's Malone Sinclaire coming to us from British Columbia. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.